Hi there, ladies and gentlemen. Welcome back to another podcast with your host, Miriam at Raise Your Vibes. Hope everybody's well. Hope everybody is sane. Hope everybody's mental health is in a good place. Hope we're all keeping away from the viruses that have been going around. Anywho, we are here to talk about our latest podcast, and our podcast title today is about parentification. Now, this is one of those topics that not everybody can realize that it's got a particular title or it's got particular techniques to it, or I guess it's labeled and classified and perhaps loads of studies have been done for it. And certain generations also, when I'm discussing this particular context, will sort of look at it and think, hold on a minute, back in my day, this is classed as normal with the speech marks around both of that situation. So what am I talking about? What does parentification mean? And how do you know if you are in fact a parentified child? Well, these are just some of the things we're going to try and explore in this particular podcast. So many of us will have grown up in lots of different cultures, lots of different backgrounds, lots of different environments. Many of us will have a very, very different experience of what family actually means and what it means to be around different adults, because some of us don't always come from stable homes. Some of us have very, very different blend of families these days. And, not everybody's family has two parents. Sometimes there's three, there's four, sometimes there's one, sometimes there aren't any. We might be fostered, we might be adopted. Sadly, some of us may be an orphan. It all depends. But parentification comes from a situation known as when we, the child, take on leadership, ownership of where the adult really should be, and we take on that role reversal, especially when we're perhaps going through a teenage situation, but sometimes it can happen when we're much, much, much younger. And often you'll find that this is in the eldest child, often, and it can cause quite a lot of issues, as you can imagine, because, you're meant to be the child, you're meant to be growing up, you're meant to have the adult looking after you, and instead it's you that's in the caregiving role. It's you that's got the responsibilities of maybe looking after the household, maybe leading things with your siblings, or even leading with responsibility and leadership and ownership, taking on roles that really aren't yours. These could be things from cooking, shopping, maintaining the house. It could be looking after the, parent that is perhaps sick or is unable to look after the household items. Many of us, will look at this and go, well, hold on a minute. This is classed as like abuse. This is classed as, lack of childhood. Maybe it's classed as generational, cultural acceptance, because many, many different families have different ways of raising us, Most of us do grow up to have chores. But parentification is basically where you are doing the role reversal of that parent, And these are different things that people explore and are intertwined with. And we suppose we don't understand that sometimes it can lead to some forms of trauma as well, So the child, whatever age, takes on that form of basically responsibility for the family. And it's at the level where really the adult should be the one taking care of the emotional and the physical well-being, the mental health well-being, maybe looking after the household aspects that a parent just physically and mentally and spiritually can't. We have so many things happening in our world sometimes when we can't do specific things. We've all taken on responsibilities for chores. We've all taken on additional things that, our parents help us with to help us into adulthood. But this is on a whole different level. You basically, in that role of parentification, you are the adult. You might not be the one bringing in the income. In some cases, that has been the case. But more or less, you are the one that's taking care of everyone's well-being. And later, in some cases, like I said, it can lead to some trauma, okay? So you have different aspects of parentification as well. you've got mainly these two types that have been identified. You've got emotional and you've got instrumental. So emotional is where basically that teenager, because obviously they're at that maturity stage where they're growing into adulthood, they're able to take on some responsibility, they're able to understand what's happening in the world, but they are able also to understand psychologically what that parent, is sort of struggling with. And a lot of these situations, you'll see that the adult will trust the child, because remember, they're still a child, they're still a minor, they're not exactly an adult, but they will trust them to be like a confidant. If they're having certain psychological issues, if they're having certain crises, there's certain things really that adult should be telling another adult. But in this situation, they emotionally lean on that teen, and tell them about certain things that's happening. So it might be that that parent then relies on that teenager for emotional support. Maybe when they're having, certain down days with their mental health, it might be that there's some conflict that they're not sure how to deal with. Maybe there's younger siblings and the parent isn't able to control them, for example, with discipline. And the teenager ends up mediating between the two. These are just some examples of that particular scenario happening, Instrumental parentification, on the other hand, is where you've got the teenager still taking on that responsibility, but it's more so full on as a parent, So if I give you a scenario, in some situations where one adult has left that family unit, the other teenager, the other child takes on that emotional support as that missing adult, So they take on the extra responsibility. They may be helping in regards to household tasks. It could be that they're taking on the cooking, the cleaning, not just on a basic level, an advanced level where you're taking care of that adult that's struggling, or the siblings that may be left in that house. But you are basically taking on major roles, not minor roles. They may be helping or assisting that parent if they're struggling financially, if that child is able to do so. Obviously, there are lots of laws, there's lots of rules. In some countries, those laws and rules are not applicable, as we know in the growing world that we live in 2025. There are many, many people that don't seem to understand that there is a big impact, though, on the mental health, of those children as well. Because when you're in that position of basically an adult without actually being recognized as an adult, there is so much pressure on you. And this is not a role that you can just cut off or stop. You try, but the thing is, it leads to many, many different types of pressures that you have as well. Remember, as a teen, you're likely to be at school. Not in all cases, okay? Because not everyone will be in that predicament. In some cases, that teen is the one that's actually running the house, looking after everybody, making sure that they're assertive, making sure that, they are looking after the parent. It leads to many other factors as well, lack of sleep. They might be more aggressive, they might be on edge, they might potentially be doing more self-harm, they may potentially suffer from more mental health issues. In a lot of cases, as I've seen as an educator, they miss a lot of school, or their grades are impacted, because they're not getting the sleep or the rest, or they're not able to do the homework or perform at school as they should do, because their mind and their focus is elsewhere. They may also be, having issues with people around them, especially when it comes to forming other relationships. i.e., they find it hard to get on with their peers because not all of them will understand the role that they have and the role that other people have as well. So, it's a tricky one to be in, and it's a tricky one to get out of as well. In the UK we have social services, but not all cases like this are reported. Some cases can be short term with parentification. some are long-term, because each scenario will depend. But in long-term situations, there is quite a lot of trauma being involved, because you've got that parentified child and you've got that extra added pressure of them being labelled as the responsible child. They're the one that looks after everyone. They're the one that's the caregiver, the nurturer. They're the one that are developing very, very quickly for the sake of the rest of the people in that household. If it's a situation where they're an only child, then the scenario is that they're looking after themselves and looking after the household around them as and when they're able to do that, And it's very, very tricky to not let that in, because some boundaries obviously get blurred at this point, It's very, very hard for an adult who's struggling to provide emotional safety or physical safety, or able to help that child heal, because they are very, very dependent on that teenager because of their own particular situation, and it's hard to get out of. So parentification situations can happen, and it can happen long term, and it has a knock-on effect to that person when they're in their adulthood and they're in a situation where they can't necessarily just get out of that situation, and it's hard for them also to try and get help, because they don't want to be in a situation where they're putting their parent at risk, or they're concerned and worried and anxious that someone's going to put them in care. They have many, many different things and feelings that go through, and sometimes it does lead, like I said, to trauma. It does lead to quite a lot of dangers in that young teens' regulation of emotions as well, because they're taking on way too much as a young teenager than adults should. And as I said, this can lead to depression, it can lead to anxiety, it can lead to potential eating disorders, mental health, situations occurring as well. And the teenager is quite likely to want help, to want to get out of this situation, to want to be able to get support. But it's hard because, later on in life, they end up not being able to trust many people. They might be involved in relationships that are not suitable for them. They may feel like this ego, having this perfection identity. Maybe they have a greater risk of different illnesses as well. And it's very, very hard to get support and to get help and to sort of switch off from those expected roles. What can help is, their adult basically, taking on that leadership role back to themselves. But like I said, if the adult is in trauma, that's not easy to do. There are more and more psychological treatments now for these types of roles and situations, I guess, that occur. Not only is the CBT, cognitive behavioral therapy, but there's lots of other different types of therapy out there. But how do you go to that when you can't identify the situation in the first place? When that child grows up, they don't necessarily have a clear sense of their own needs, because they'll continue into adulthood being a caregiver. They'll continue being somebody with empathy, and a complete empathy. There's nothing wrong with having empathy, but they're at that level where they don't understand how to say no. It's very hard for them to form very, very healthy attachments in later on in life, because they've got used to being the caregiver. They've got used to people being around them, needing them. And also identifying that needing behavior is quite hard. The emotional growth of that child is on a restraint. Also, that child sometimes doesn't understand, that their parent does need help. And like I said, they go through that fear factor where they're trying to understand that, my parent does need help. My parent does need support. My parent does need help with their form of attachment. And the one the pressure that they're putting on me is not the way of dealing with it. And it's very, very hard when lots of families, you know, what happens indoors isn't always expected on the outside. Sometimes it's very, very hard. And for those people that are struggling, you know, they don't always understand. There's so many different aspects to the parent, and they don't necessarily want someone coming in and someone, you know, meddling with their situations. You know, you could have very, very intimate issues where a parent's disabled, or a parent is struggling mental health wise, or struggling with substance abuse and so on. And obviously different types of people will try to come in and help that parent and that child. And it's very, very difficult to, you know, get some form of support for that different type of attachment that they have with each other. And obviously this impacts so many different aspects. I mentioned education earlier, and you know, you do see it where their attendance drops, the academic side of that student drops, and schools will do their best to report it, put things in place to try and help them and catch up. You know, they'll do all sorts of different things, and then outside agencies do get involved, and sometimes that takes time itself to go through all that scenario. The parent themselves, you know, need to work on their different relationships. Clearly they're in a very, very secure attachment with their child, and they formed a bond, but it doesn't necessarily mean it's the right one for what they're going through, you know. And we can empathize and we can sympathize with them because they want to keep things, you know, a secret. They don't necessarily want the outside world knowing their business, but it can leave that child or teen suffering. And that's the thing, it has a long-term effect, you know, because later on in life those intense feelings can be demonstrated as rejection, disappointment, anxiety. We form different patterns of behavior which we don't necessarily see that we're doing, but we are, you know. And it's hard to break free because it has these effects on us and we don't see it as adults. And that's why I'm addressing this particular one, because not everybody understands that to heal from it, we need people to understand, and we need more people that are regulating us and regulating themselves. Because, you know, sometimes we'll exhibit things like stress, we'll exhibit anxiety, we'll exhibit different boundaries, and we don't necessarily know what healthy boundaries are, and we don't know how to say no. Sometimes we hold on to that anxiety and that anger and resentment and guilt because it's been manipulated, and I say manipulated in a inverted comma way, you know, because when we're caring for our parent, yes, we come from a place of love, we come from a place of emotional attachment. But sometimes if that parent is dependent on drugs or on various other aspects or different things that they're, you know, addicted to, maybe they're just not in a good place to heal themselves, then it's very, very difficult because we are manipulated with guilt to look after them and to care for them when sometimes they don't care for themselves, you know. Obviously, we can help ourselves with self-care, but how can we do that when we don't know what self-care is? Because we've spent our energy and our time looking at and focusing on the adult who's not practicing self-care. So that's a hard one as well when we're in adulthood, you know. Nowadays, there are more mental health support groups for this type of topic. There wasn't before. And you know, when you're in a situation such as parentification, you're often isolated because other teenagers, other adults won't understand your particular predicament. Not everybody will understand or recognize what you're going through. And you know, and often they'll go, oh, you know, like, just leave that person, don't have any interaction with them. Well, how can you when it's your parent? You know, so there's a lot of emotional guilt, there's a lot of back story to it that not everybody understands, that there's this extra trauma added to that, you know. And not everyone will understand that it's very, very difficult to step away from, And it's very, very difficult for us to say no, because this is your parent. This is your parent, and it's your parent that's wanting support and help, and it's not just things about around the house. And if you're in a situation where that parent is showing signs of sensitivity, emotional blackmail, or the narcissistic, it's very, very hard, because it ebbs away at you, it ebbs away. And you, as the parentified child, also need healing, and you also need to help and support. Which is why sometimes, like I said, when it happens to us in our teenage years, we find it hard to practice that self-care. We find it hard to set boundaries and say no, because we've been taught the opposite whilst we're in that situation. We find it very hard to connect with other people. We find it hard to educate ourselves, and we find it hard to also ask for help. Okay, but we do need it. We do need it. So how do we go about that? Well, nowadays it is recognized more and more. There are, self-help groups. There are treatments out there. Like I said, there's a lot of CBT, but sometimes we don't often realize we're doing it. And statistics have shown it's more so in females than it is males. It's often like the parentified daughter, which is a term, believe it or not, is where you're taking the role of the mother and you're looking after everyone within that household. And you can imagine, like I said, culturally, for some of us, this will seem normal, inverted commas, that it was normal to look after your siblings, normal to raise your siblings, normal to take them to school. But different generations have different viewpoints of normal. Nowadays that would not be acceptable. So there are times when we have to also try to think about ourselves and think about the labels given to us. And a lot of the times, these people that are in this category are often very alone. They're very scared, they're very vulnerable. They might be very mature, they might be very grown, and they are in many, many, many ways. But there's also a side of them that is, very, very distraught and very, very silent, and also someone that needs support and help and guidance. And if they are able to open up, then great. Sometimes it's finding another person to be trusted, because letting people into that trust circle, that's a hard one on its own, right? But we have to try, emphasis on the word try, to let someone in. And it's a long road of recovery, because like I said, if you're a parentified child, you're clearly, very, very centered on other people, and you've lost that focus on yourself. And it's very, very hard to try and focus on you, and that's the situation. You've got to think about all the different areas of, aspects and areas around this. And in many, many cultures, like I said, a lot of this will seem normal. To others, it's not. And nowadays, in 2025, it's a matter of identifying those different layers, identifying those different aspects, and seeking help and seeking guidance. And again, for some of us, that's quite hard to do as well. Hopefully, in our society, we can spot it though. You might have someone that that's got way too much responsibility than they should have. Maybe you spot someone that is struggling. Maybe you spot someone that is taking on way too many roles that they shouldn't do. And, perhaps they need support and help. And it takes a little chat, doesn't it, to have a little bit of conversation with that person, although it might be a very, very difficult one to have sometimes. But it's making sure that that child is fine and their mental health is fine. And if you come across someone, use your tactics, use your common sense, use your love, as we say, and see how you can tactfully help that person get support and help and guidance that they need. This is one of them, podcasts or topics, should I say. It's not a nice one to talk about, because nowadays, there are some generations that don't really care about their parents, and there's some that clearly do. And there's some that clearly feel trapped, and there's some that just have no harm, but they have no choice. They're stuck in that position and there's nothing else they can do but support their parent and child. And if that's you, or has been you, make sure you go out there and get some support. It doesn't matter how old you are, it has a long-lasting effect. And clearly, some of us out there need that help and support. Thanks for tuning in. This has been a podcast about Parentified Child and parentification. And if you do recognise some of the symptoms out there, hopefully we can help others around us. That's all for now. Thanks for tuning in.